I'm Dr. Neeta Nayack. I am board certified in hospice and palliative medicine. I finished my fellowship at the University of Chicago in 1999, and I've been doing hospice for almost 25 years. I started with custom care about 4 years ago in 2020, so I felt like the two specialties meld with each other perfectly. It's been a joy working with them since. The reason I was all ready to be a gastroenterologist. I had started at Mayo Clinic, and I think I had an epiphany that was not right for me. And what appealed to me as I look back was my time with my grandmother. It was so special. I realized that I gravitate very easily towards older folks, and here I am. There certainly are a lot of misconceptions and misperceptions. We want to hold on to that last moment of life, so it's very natural to resist something or someone that wants to offer us something that might make those last moments better. The number one misperception that I have had to face with my own patients and family members is that hospice hastens the dying process. And studies have shown that it actually does the opposite of hastening the dying process. In fact, there was a study on end-stage lung cancer patients a few years ago where it was shown that people that elected hospice versus the folks that went with aggressive treatments had a distinct difference in the length of their life expectancy. People live longer, people live better when they choose hospice care. People receive the best quality of care at the time when they need it the most as they're coming towards the end of their journey. And nobody can provide it better than a well-constructed, trustworthy hospice team. We never stop medications that are continuing to show benefit in the patient. We are very thoughtful before we stop medications, and we always get consent from the patients and families before we do so. So hospice is a team approach that cares not just for the patient, but we want to involve the family in every step, every decision that's made. So the family is an integral part of who we care for, and getting their buy-in and utilizing their knowledge, their observations of their loved one is key to our formulating our eventual plan of care. The family contributes a lot towards our care plan, towards our ultimate care plan for the patient. Patients also believe that they lose their primary care physician with whom they have had a wonderful relationship probably for 25-30 years, and we reassure patients that they are welcome to keep their primary care physician as their attending of record. The hospice physician is just a secondary physician to provide an extra level of care in addition to their primary doctor. Getting on hospice at the very last moment, the last day, the last week of life really deprives the person from getting all that hospice has to offer. Hospice is a nurse-driven organization, but there are nursing aides, social workers, chaplaincy, music therapy, sometimes pet therapy, volunteers, so much that hospice can offer. So to experience all of this, I recommend to my patients that they choose hospice earlier on in their end-stage disease process rather than waiting until the last day or last week of life. I've worked with Custom Care for about the last 4 years, and I've known Custom Care for probably ever since inception. I have loved working with Custom Care even before I became one of their hospice physicians. There's something so genuine about the organization that matters a lot to me. I feel that almost everybody that I've worked with has been so caring, so compassionate, and competent. And the perfect blend of competency and compassion sometimes is hard to achieve, and very few people have that gift and talent. But I feel those people have somehow gravitated to this agency, and for that I'm very grateful. Having that trustworthy team by your bedside as you're coming towards the close of that journey, having people with whom you have an established trustworthy relationship, I think is integral to experiencing and getting the most out of hospice.